Hi, welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine in Houston, Texas. Today, we're going to talk with my special guest about the Proclaim XR spinal cord stimulator for diabetic peripheral neuropathy. The FDA recently approved Abbott's Proclaim XR SCS system for the indication to treat diabetic peripheral neuropathy in January 2023. The Proclaim XR system can provide relief to diabetic peripheral neuropathy patients in need of alternatives to traditional treatment approaches, such as oral medication. Did you know 34.2 million Americans, or about 10.5% of the United States population, has diabetes? Diabetic neuropathy, one of the complications of diabetes, is a type of damage seen predominantly in the nerves that run down to the feet. Approximately 50% of adults with diabetes will develop peripheral neuropathy during their lifetime and experience symptoms such as pain and numbness in the legs, feet, and even in the hands. As a leader in diabetic care and monitoring, Abbott is intimately familiar with the challenges people with diabetes encounter daily. So today, I am pleased to introduce my guest and colleague, Dr. Denis Patterson, physician owner of Nevada Advanced Pain Specialists. Hey, Dr. Patterson.
Hey, Suzanne, how are you?
I am great. It's so good to see you, Denis.
Great to see you. Greetings from Reno. I know you spent some time here, so it's always good to catch up with the colleague that you used to work with.
For sure. You're one of the first people I met when I moved to Reno in 2011, and you were there to serve me and to mentor me, which I'll never forget. You gave your valuable time to me and the patients in Reno, Nevada, which you still do. And you are, I've always looked up to you. You've always had a good heart and treat your patients so kindly.
Well, thank you for that. I do try my best, so I appreciate those kind words.
Absolutely. So I really appreciate you taking your time out of your busy day today and spending the afternoon with us here on Pain Diaries.
Yeah, thank you for having me. I'd love to talk about stimulation and how I can help patients, especially who suffer from chronic pain. And so I'm always willing to do these types of interviews to spread the word and let people know that there's options out there to help them.
Absolutely. And I know you've been involved with societies and the promotion of the field. We're always trying to advance the field, so see what we can do to help patients better. So let's start with that. What societies are you involved in and research and things like that?
So at a national level, I'm involved with the North American Neuromodulation Society, and I'm also part of the American Society of Pain and Neuroscience. At a regional level, I'm part of Pacific Spine and Pain Society. I'm on the executive board for that. So I actively try to attend all three of those meetings on an annual basis. I've been very lucky to have been asked to speak at a lot of those events and even teach their labs and help other physicians. And those are the main societies that I'm currently involved with.
Yeah, that's fantastic. I mean, being involved at a national as well as a regional level with the Pacific Pain Society, it's really great. So today I'm really excited to chat with you about diabetic peripheral neuropathy and the treatment with spinal cord stimulation. So I want you to first explain what diabetic peripheral neuropathy is and really how it affects patients.
Yeah, so diabetic neuropathy is an interesting disease, right? So just as you were saying, about 35 million Americans suffer from diabetes. And as a result, with diabetes, you have a higher level of sugar in your blood. Unfortunately, when you have those higher levels, that can be caustic or cause damage, and it usually does it in the smaller end organs, like your blood vessels down in your feet and eventually in your hands. And so it kind of goes hand in hand with what I'd say is peripheral vascular disease. So the higher blood sugars cause damage to those small microvessels. Those small microvessels then are unable to get nutrients to the nerves in those areas. And as a result, the nerves become damaged and as a result, cause the patient pain.
Yeah, for sure. So again, I think the issue we've faced over the past many years that we've been practicing in our decade of practice now, the treatments have really only been symptom management and, behavioral modifications, not necessarily anything that's really curative yet. But spinal cord stimulation, we're going to talk about that, how that helps relieve the symptoms of diabetic peripheral neuropathy. So can you touch on that a little bit?
Yeah, you're exactly right. I mean, and just as we were saying that about 50% of these patients with diabetes are going to develop neuropathy. So that's about 17 million Americans, correct? So that's a huge population that suffer from this. And as you were saying, throughout my career, I've seen these patients, I've tried to manage them. Usually we're trying medications, whether they're topical like lidocaine or capsaicin cream
Yeah.
or even oral medications like the gabapentins or the pregabalins, or even the SNRIs like duloxetine. And what we see is that there are some patients who do benefit, but my experience is they usually fail them over time, and we're unable to control their pain. And unfortunately, a lot of patients end up on opioids. And as we know, over the last decade with the opioid epidemic, that is not the route we want to go, and we need to find better treatment options to help these patients.
Absolutely. Yeah, it's really challenging because you give the patients these nerve modulating medicines and they're like, well, it's not really working. And then we don't really have much else to offer. And, for years we've been using the stimulation off label for the diabetic neuropathy. The cool thing is now it's FDA approved. Like, we're so lucky to now have this indication.
Yeah, and it just seemed to go hand in hand, right? I mean, we've treated patients with stimulators for years. The technology's even really gotten extremely better over the last 5 to 10 years.
For sure.
And traditional stimulation has worked with patients who have nerve pain. Well, what is diabetic neuropathy? It's nerve damage. So it's pain due to the damage to the nerves. And so it just seems hand in hand that this would be a perfect modality to treat these patients.
Absolutely. And it's nice because the stimulation kind of mimics those natural patterns that, that can be found in the brain that allows us to help ourselves with pain relief.
Absolutely. And it, I mean, kind of the Proclaim XR stimulator with Abbott seems to help in two ways, right? It helps actually with the making the pain better. So it helps with the lateral pathways. So the patient, instead of having this dull toothache, sharp pain, it feels better or relaxes it. And the other thing it is it kind of helps with the medial pathways of the brain. It helps with more of the emotional aspects of pain. So patients don't perseverate on their pain anymore. They're not depressed because of it, and they're able to resume normal activities and get back to life.
Yeah, I've always been fascinated on how it does that treatment to the affective pathways, and it really helps people's mood. And it almost, I wouldn't say it's a cure for depression, but people get frustrated situationally with that pain that they're suffering from for years. And there really hasn't been, again, like a medicine or anything to fully reverse it. But with stimulation, you can really filter that signal. And again, hitting the medial and lateral pathways in the spinal cord for the pain relief as well as the mood and the affective side of pain has been life-changing for so many people.
Absolutely. Every patient I see, I always tell them about 70% of them are going to suffer from some type of depression or anxiety as a result of their pain. And a lot of times we help the pain, but the depression and anxiety still persists. And so it's nice that not only is the stimulator helping their pain, but it's also going to help their anxiety and depression that's associated with their pain. And so you're kind of right. It's kind of a 2-for-1, which is very difficult to treat. And what's great about it is when this works, it works. It's not a medication. It's not going to cause them long-term damage to their kidneys or livers like oral medications does. It's a device that basically they can control, turn on and off as they need it, and very safe in the hands of trained physicians such as ourselves.
Absolutely. And I do tell patients, like, yes, we're giving you a dose of electricity, like a dose of medication, but it's electrical medication. So it's still like they're getting different dosages because you can change the frequency and you can change the patterns of the stimulation and the waveforms. That's going to give different types of stimulation, whether they like the feeling of it or they want it on a little bit higher where they don't feel it. So there's just so many different mechanisms on how to deliver it through the spinal cord to really relieve the pain, and it's very independent to each patient.
Yeah, absolutely, and that's what's great about it. Is you're right, it's not a one-fits-all. We can adjust it and we can fine-tune it to give that patient the best chance of success as they need.
How have you seen it being effective compared to traditional treatment options?
Oh, it's by far superior. I was involved in a research study regarding stimulation for neuropathy, and what we saw is very few patients succeeded with chronic medical management The stimulator group, on the other hand, really did extremely well. And I would probably say 90% of patients were in the conventional medical management arm. And when they could cross over at 6 months, all crossed over to the stimulation group, and the results have been fantastic.
Yeah, that's amazing. I mean, spinal cord stim has now been recommended and been used in treatment for 50 years to help manage chronic pain. And now it's so great we now have the actual indication by the FDA to use it for the diabetic peripheral neuropathy.
Absolutely, because as before, you'd kind of hope that they'd have some other condition along with the neuropathy so you could get the stimulator approved by insurance to put it in. And you knew that you're just kind of using those other diagnoses, but the main pain that was causing it was the neuropathy. And so it's great now that we don't have to focus on other conditions to get this approved. We can actually just use this as the primary diagnosis to help the patients.
So true. So when you see a patient in your clinic, I mean, how do you determine if that patient's a good candidate?
Oh, a couple different things. One, I want to make sure the pain is neuropathic, correct? And I'm not misdiagnosing them. And so neuropathic pain is there 24 hours a day, 7 days a week, 365 days a year. If it's mechanical pain, it'll usually go away with rest or not being active. So it's really easy by just asking the question on how often the pain is there to figure out that it's neuropathic versus mechanical. The second thing is I just want to make sure that it's a patient who doesn't have any underlying psychosocial issues that would prevent them from succeeding. So with all patients who get a stimulator, we have to send them to a pain psychologist to get clearance. Essentially, we're making sure they're not, suicidal, they don't have depression causing their pain, and that make sure they have a clear understanding of what the device is and how it could kind of benefit them, and that they have clear expectations that it's not going to be a cure. It's just going to help them manage their symptoms and make their condition better. And then the last thing is I want to make sure the patient has the mental capacity to actually operate the device.
Right.
If they are able to operate it, then it's going to be useless and probably be taken out in the future.
Absolutely. And then for those diabetic patients, what is your cutoff for like when you check their A1C levels and things like that? Because obviously as docs, the last thing we want is an infection, and higher blood sugar levels can lead to possible infection. So what are your cutoffs?
Yeah, the study I was involved in, it was a hemoglobin A1C of less than 10. And using that criteria, we saw that the chance of infection was no different than the regular population. So I've adopted that in my practice after seeing that from that clinical study.
Yeah, that's huge, because again, the indication is for diabetic neuropathy, but we don't want to withhold the therapy because they're diabetic. So.
Correct. Or it's just slightly uncontrolled at the time that you see them, It's hard to get it back under control for some patients, especially when they're having pain, because they can't be active, right? And if they can't be active, they can't lose weight and or improve their hemoglobin A1C.
For sure. Anything else you'd like to add, Dennis?
No, I think that I just want to say to patients out there who may be listening that this is an amazing therapy. I've seen, transforming changes in patients that it's just changed their life. And I think the great part about stimulation is you can try it before you buy it. Mm-hmm. So it only takes a short trial as an outpatient in your physician's office to have these leads put in. And you try it out for 5 to 7 days, the leads come out easily. And if it works, then it's a minor surgical procedure to put it in. And I hate the word permanent, because we always say a permanent implant. But I mean, if it doesn't work long-term, it can be removed easily. So it's not permanent in that sense.
Exactly. And since you're in Western Nevada, 12 miles over the California state line, tell people how to contact you.
Oh, God, I'm in Reno, Nevada. My clinic is Nevada Advanced Pain Specialists. Our website is nvadvancedpain.com. And our phone number is 775-284-8650. And any patients in this area that would love to come see us, we'd love to have you. Just call and tell them you saw this segment, and we'll get you in.
Awesome. And I have patients here in Houston that come see you there when they're out in California and Nevada.
And no, it's such a small world that we share patients. So
exactly, we still share patients.
3 or 4 states
12
away.
years later. I love it. Thank you so much for being here with me today. People in Nevada are lucky to have you, and We appreciate your time. We'll see you soon.
Always great to see you. See you,
Thanks,
Suzanne.
Dennis. This is Dr. Manzi with Pain Diaries, and we'll be back after a commercial break.